Good afternoon, everybody. Welcome to the fourth episode of Digi4Care podcast. My name is Šimon Jesniak and I will be your host also in this episode. And I would like to welcome my two dear guests. On my left side is Kristina Randlova from Czech Republic. And on my right side is Gordana Gardašević from Bosnia and Herzegovina. Welcome, both of you.
Thank you for the invitation.
Thank you for accepting the invite. Gordana, could you tell us a little bit about yourself, about your profession, and how did you find out about this project, and what is your role in Digi4Care projects as such?
Yes, thank you. And thank you once again for the invitation. And I have to say that I'm really honored to be part of this project. I am a full professor at the Faculty of Electrical Engineering, University of Banja, Luka, Bosnia and Herzegovina, and the Department of Telecommunications. And exactly what I'm working on is the field of wireless communications, digital technologies, also recently artificial intelligence, machine learning. That's all multidisciplinary field exactly. So I was very interesting when the team offered me to join this project, and now I'm working towards implementing this technology in our area, which is quite new for our region, but probably we will talk about this later.
If you would have to describe the relationship between wireless technologies and the current medicine, what would be the answer?
That's a perfect match. And I'm always saying that the best possible application of telecommunication and technology is exactly for healthcare and for medical application. That's the field where we can show the humanity of technology, let's say. And that's new technologies can really support it a lot, healthcare sector, because we are moving towards personal medicine. We would like to help patients, but also doctors and all other that are working for healthcare industry to work more productively, to understand better data. They observed medical data that to take off the burden from their shoulders when we are speaking about management and everything. So I do believe that technology can really help a lot.
That's correct. Technology, in addition, is also the future, and the future of the new professions in the healthcare in general. So this will be one of the fields that will be growing extremely fast, and it is already happening. So Kristina, what about you? What I know about you is that you are one of the, I don't know, it's the correct expression, godfather or godmother. It's probably godmother of this project, and that you've been at the beginning of this project.
I am from the Prague University of Economics, and for the long time we are interested in the care of people with Alzheimer's disease. And we are happy we can be a part of this project because for us that's an opportunity to realize some of our plans and activities in connection to using technologies in Alzheimer's care. I think using the technology is a necessary part of or next step of disease management of Alzheimer's, because the number of people with Alzheimer's is still increasing, and the resources, including human resources, are limited. And this project is providing us a perfect opportunity to try how technologies are working in reality, if it is feasible and usable. So we are really happy to be a part of this project.
And you're currently a PhD student, if I'm correct?
Yeah, I'm actually a PhD student at Prague University of Economics at Faculty of Management with a specialization to healthcare management.
Thank you very much. So basically we've made an introduction, and today's topic is testing digital solutions for monitoring and rehabilitating dementia, Alzheimer's and cognitive disorder patients in long-term and post-ICU settings. I know it was a complicated beginning, but we will break it up and we will speak about all of those topics separately. So we will start with the introduction, and that's the challenge related to Alzheimer and dementia in Europe. Basically, we can say that dementia and Alzheimer's and form of dementia is the disease of the 21st century. There are really millions or maybe even 100 millions of the people who has Alzheimer, will have Alzheimer, or not being diagnosed with the Alzheimer all around the world. In Europe, according to data, it should be around 7 million people currently, and it could reach 14 million by the beginning of 2050. Gordana, how are we prepared, or how are we working on the process to be prepared for such exponential growth of the people who are or will be diagnosed with any forms of dementia?
Yeah, that's true. That's the data from 2090, that number of near 8 million people that are struggling with that group of cognitive disorders and also Alzheimer disease. But there is one positive news, that in the last 25 years there is a declining trend thanks to new technologies that are involved in process working with people with this type of cognitive disorders. So we can be more optimistic, and we do believe that introduction of these new technologies can help a lot in prevention, mainly in prevention, and also it's important to say that awareness of this disease is something that is really important. Also, we need to take into account that it's not only about the patients and residents, but also their families, co-workers, medical team. That's one ecosystem that is involved in this process.
Yes, really many participants are related and influenced by this illness. As far as I know, also the advantage is that the diagnostics of the Alzheimer is really making a huge progress after a pretty long time. We could even say after decades, and now we have made some significant progress, and there is a pretty solid chance that we will be able to cure dementia and Alzheimer forms.
Exactly. I have to say that machine learning and artificial intelligence can help us to understand better what's within the data that we obtained from the patient. So then we can get more information about the whole process, and that's something what is really important. But we do not understand at the full capacity that whole problem.
Yeah, in a lot of European countries there is a problem with underdiagnostics of people with dementia and Alzheimer's disease. And for example, some predictions from Czech Republic are telling that only 25% of patients with dementia have an official diagnostics, and 75% of people doesn't have diagnostics. So official prevalence numbers are showing only people with official diagnostics and not a real amount of people with dementia or Alzheimer's disease.
What is the biggest struggle in diagnostics? The fact that people do not attend, for example, the preventive checks as much and as soon as they should?
I think that's a problem, that official diagnostics of Alzheimer's disease is a long process. That's not only one quick test, but that's a set of more visits in specialists, more tests, and it takes a lot of time. And minimally in the Czech Republic, actually that's not some one easy test to predict or diagnose Alzheimer's disease or other dementia. That's a long process, and insufficient healthcare professionals to these diagnostics.
Yes, in general, we do not have a sufficient amount of the healthcare professionals in all the Europe, or we can say in all of the Western civilization. Some of the countries have sufficient amount of doctors, but the lack of nurses, or vice versa, or some of them don't have sufficient amount of doctors and nurses. And dementia and Alzheimer is especially influenced by this, because a lot of medical staff and other supportive staff needs to work in order to maintain and help the people diagnosed with the Alzheimer, for example, in Alzheimer's homes, etc., etc. So, can we describe the impact of the staff shortages? We can mention the examples from Bosnia, from Czech Republic, or from the whichever countries comes to your mind.
Yeah, I think the staff demands is a really big problem because Alzheimer's disease is really demanding on personal resources because people with Alzheimer's disease need some help every hour of their life. Sure, it depends on the stage of the Alzheimer's disease, but that's not also about nursing care, that's not also about cognitive rehabilitation, but that's also about the help of everyday activities, everyday life, and it needs a lot of stuff. And unfortunately, the resources aren't unlimited, and
they never will be unlimited.
Yeah, and it means in the future it could be a big problem to find a sufficient amount of staff.
Will be
for
or
the
already
care.
is? My impression would be that it is already a challenge. That
started to be a problem. Yeah, because the capacities of the senior houses and houses with a special regime are limited, and it doesn't cover amount of people who needs help, and there are in some regions a long lists, waiting lists of clients who are waiting to care in specialized facilities because sources are limited and the staff isn't sufficient to provide care to everybody who needs it.
one of the goals of the Digi4Care project is also to work on scenarios or the pilot projects about how to overcome this problem, and this is also the pilot project related to Alzheimer and dementia. Gordana, could you explain the aim and the feasibility of the study of the digitally supported cognitive training that this pilot is currently working on for a few months already?
Yes, I have to say to mention that this is a feasibility study. This is not a medical study. What we would like to know is how participants, how patients, how medical team assess these technologies. What's they feeling when they are working with this novel technology? Do they feel comfortable? Does this technology...
you mean patients or the medical professionals?
Both of them, because we provide and we perform some questionnaires and some interviews to get more answers and to see if we are on the right track. So there is also one interesting activity. That activity is related to healthcare technology assessment. And we would like, if this novel technology can replace all those that we used before, and what is the added value. So this is something what we would like to see and to study based on this data.
Yeah, and for example, in the Czech Republic, the main goal aim is that actually there are a lot of technologies who are available on the market for people with dementia, Alzheimer's disease. But if you will visit some average senior house in the Czech Republic, you will not see these technologies. And the question is why they are not using it. And because of it, we have this feasibility study to implement the technology and see if there are some specific severe barriers of implementation or try to answer the question why they are
or
not
the lack
using
of willingness
these
to use it,
technologies.
or the lack of willingness to start using it. Do we know? Because you have raised a very, very crucial and fundamental question. Now you can also answer it.
We are in the phase of the process, and now we are identifying some first barriers of implementation. But I think none of them is too serious to don't use the technology. So maybe that's only to start think on some different way, to start accept technology as something necessary for the future sustainability of the specialized care providing process because of the insufficient amount of staff because technology is something what could help with this insufficient amount of stuff. It could help with a quality of care who is providing. So we have to adopt a new system of technology providing with technology.
Understood. In the previous episodes, I've been speaking with your colleagues, for example, about cardiovascular diseases or diabetes, etc., etc. So basically about the patients who are aware of the state of their mental and physical condition. But patients with Alzheimer and dementia, they don't have to be in a certain stage fully aware of it. So there must be some challenges regarding using these technologies by the patients. Could you try to discuss this topic and how are those technologies or games or quizzes or questionnaires or anything like that? Is it user friendly, but user friendly not like for the general audience, but user friendly for those specific patients?
Yes, in my opinion, these technologies really can greatly enlarge the impact of all these assessments in terms that we expect that all those patients, especially when the technology can process and analyze result by itself, that is something that is very important. So the staff will spend less time, doing the administrative work because the technology
additionally on the paper usually.
Yeah. So there are a lot of possibilities. When you introduce artificial intelligence and machine learning, you can create a limitless number of different types of questionnaires, so for different target groups. So we have much more options than when we are working with regular, let's say, regular equipment.
You want to add something, feel free at any time.
Yeah, I only wanted to tell that, for example, in the Czech Republic, we decided to try to using the technology in various groups of patients with Alzheimer's disease based on the stage of the Alzheimer's disease to see if the technologies are feasible in these groups based on the stage of the Alzheimer's disease. Because that's the truth that not every technology will be feasible for several stages of disease, because some technologies needs a part of activity from the clients. And for example, we are testing two technologies for cognitive and social rehabilitation. One of them is a set of cubes for cognitive rehabilitation, and second of them is social robot. And cubes for cognitive rehabilitation needs clients who are more active because they are actively using the technology, and it isn't feasible for people with severe stage of Alzheimer's disease. But on the other side, robot is more easy for using by clients. And this robot is feasible also for several stages of Alzheimer's disease. So the question is also...
Yeah, that's true. And also when you have a sensor technology, you have the opportunity to understand better interaction between patients and device. So the device can recognize, let's say, something...
Who's using it? Device can
Yes.
find out who's using it based on the machine learning.
Exactly, because there are a lot of sensors that can actually better cooperate with all these activities, so they can help in produce more relevant results. So that's the idea.
The fundamental question that the pilot is working with is if can technology save personal time while maintaining or improving care quality for those patients who are maybe not already in Alzheimer homes but are very close border to being also already placed if there is no other possibility in Alzheimer homes.
It depends on the type of technologies, because in the Czech Republic we are implementing more technologies. And some of them can save time, but still the most important is the quality of care, because we are seeing the healthcare and social care as a patient-centered care, and the most important is the quality of care, and these technologies can improve the quality of care, and the saving time is some second effect of using these technologies. And for example, at the beginning it is usually a longer process in connection to learning with a new technology, so it takes more time, but when the staff will learn with the technology, then it can save the time.
So it means that we are able or will be able to measure the amount of time that was saved by using technologies?
Yes, exactly. Let's say today we had a chance to visit two different facilities, and in one particular case, the examination for previous case would be, let's say, 1 day. With this new technology, in, let's say, 10-20 minutes, you can obtain relevant results about the patient
so you
health.
can basically save tens of thousands of human hours only thanks to technology and its progress.
Exactly.
Yeah, what is important, for example, in connection to our technologies in Pilot 4, when I will use an example of cognitive cubes, the nurse will turn on this technology, and then client or patient is doing cognitive rehabilitation with this technology, and during this time the nurse can do another activity, so it isn't necessary to be with a client every second of cognitive rehabilitation, because the core of cognitive rehabilitation is inside of the technology, and the client is using it by himself without the need of 100%
focus on the nurse.
From the nurse.
Or the nurse can help 20 patients at once.
Yeah, that's the main idea of using the technology, because in one time she can provide a quality care for more patients and not only for one patient.
Based on your experiences, both of you in Bosnia and Czech Republic so far, what's the response of the medical professionals towards the technologies and implementing those new technologies? Medicine is, I don't know if it is famous or it is typical for being conservative for very good reason, because we are dealing with the human health or even human lives. So what's the attitude of the medical staff and maybe even patients and their families towards implementing the new technologies?
Yeah, regarding the medical staff, well, it depends. Generally, new generation in medical field are quite aware of what's going on in this field of networking, internet and artificial intelligence, etc., etc. So they can use it. They know a lot about these technologies. But on the other side, let's say in this retirement home, which is our partner within this pilot project, digital literacy is not at such a high level. So let's say we are struggling to introduce them to this
especially
activity.
among elder people.
Yeah, and
or also let's say among millennials, etc.
Yeah, I would say both groups, but also for
Sorry, I didn't
elder...
mean millennials. I meant boomers, but
yes,
that's my mistake.
But especially for the group of elderly people, yeah, they're, let's say, a little bit resistant, but only at the very beginning. But then I have to say that we have a very positive response from questionnaires and interviews, and we can really be optimistic towards the use of this technology. But in Bosnia, we are at the very beginning of implementing this. This is just the initial phase, and with equipment, we will have a complete, let's say, view on this problem.
Yeah, in the Czech Republic, we are testing technologies from the first months of this year. So we have more experiences in the Czech Republic.
The year 2025.
Yeah, 2025. And I have to tell that maybe we have actually better feasibility, better reaction from clients than from staff. Clients really like the technologies, they want to use it, and the feasibility is maybe sometimes higher than from the staff.
If I would have to guess, there is also the level of the entertainment for the patients, that they basically, it is not painful when you are training a cognitive functions, that it is also a way how to entertain yourself. Am I correct?
We have more technologies, and the cubes for cognitive rehabilitation looks like a game, so that's something which is training their cognition, and that's a really attractive form of rehabilitation, so they are really open to using this technology. And the second technology for cognitive and social rehabilitation we are using is a robot. It looks like a robot, and it is telling with the clients, it's telling jokes, stories, fairy tales, and a lot of other contents, and that's really attractive for clients. So that's a way of cognitive rehabilitation who is valuable, and in the same time that's attractive for the clients, and they are really open to use it.
Can we say a little bit about the methodology and about how the study works? Kristina, you can begin, please.
Methodology of Pilot 4. So
yes.
we implemented the technologies, and during the using of technologies we are collecting data. We are collecting data from patients, clients, from employees, and from facility management. We are collecting data through questionnaires, technology acceptance questionnaires, and also through interviews with management.
Understood. Gordana, could you introduce or tell us a little bit more about the technology acceptance model? It's short is TAM, but it is not very well known term.
Yeah, actually, technology acceptance model is introduced to somehow cover the gap between research part and the stakeholders that, let's say, tomorrow should take some decision regarding the introduction of digital technology and their implementation within the healthcare field. So this aspect tackles also social, economic topics within this field, not only medical data and work with patients and stuff, but also covers all other important aspects. And what we really would like to see is that at the national or regional level, we can see the implementation of all these activities tomorrow, let's say, or in a near future.
Or in a real time.
Let's say, as quickly as possible. We are now, I think that we are a pioneer in this field for, let's say, Balkan region. This is something that is very new, and the project is a kind of pioneer project in this field. And
very unique.
Very unique, and I believe that results from this activity will be very interesting for all others in Europe and maybe globally to see if this is the path we should continue on towards.
Kristina, you're also using the health technology assessment method. So can we speak a little bit about this segment?
Yeah, sure. What's important to tell, we are using a part of health technology assessment methodology.
Because usually people are more familiar with HTA in drugs than in technologies.
That's usable for drugs and also for technology, but what's really important, and Gordana told at the beginning, we are having a feasibility study and not a clinical study. And health technology assessment is a comprehensive multidisciplinary type of assessment, including a lot of points of view to technology. It includes a description of the technology, description of target group, comparators, safety, effectiveness, cost effectiveness, ethical aspects, organizational aspects,
patient
really
aspects.
Yeah, and in this project we are mostly using organizational aspects domain and patient aspects domain because these two domains are interested in feasibility questions, how the technology will affect work processes, how it is feasible if the staff and clients are adopting the technology without problems, if are some barriers of implementation into the actual work processes in facilities.
We have already mentioned that you are evaluating the whole project based on the also questionnaires and the feedbacks from the patients, from the healthcare professional, and the facility management. And Gordana, you have mentioned that a little bit maybe surprising was that the best feedback was coming from the patients, right?
Yes, in our case. But I would like to stress that there are 7 partners within this project, and each country has its own very specific, let's say, regulations, and also regarding the ethics and other regulative. Bosnia and Herzegovina, we are also struggling to follow adequately all other partners, because we are a non-EU country and we have some different protocols, and that's something that we need to manage during this activity. But okay, let's say we are.
You're succeeding.
I'm an optimist. Yes. We will succeed to.
It's crucial, not just in a project, but in general.
And also to provide recommendations to our stakeholders and government, and to tell them how they should lately implement all these activities. So this can be a key points for them to start to be more active in this field. Up to now, they're not so active.
Kristina, what would be the ideal or wanted success or wanted outcome parameter of the testing of digital solutions for monitoring of patients with various forms of dementia?
Once more, please.
Sure.
I'm not sure if I understood what's the core of your question.
Yes, we are speaking about outcome and parameters, and what the success of the project or the end result of the pilot project would look like.
Mm-hmm. I think this project has, or minimal this pilot has more goals. One of them is identification of barriers of implementation, and I think the success is to identify these barriers if there are somewhere, and the success will be that the technology are feasible, and staff and patients want to use this technology, and they see some positive effect to their work processes, to quality of care who is providing, and to see some real outcome of the technology. And for example, we have some first previous results from technology acceptance from clients,
from the integrated model.
Also from staff, and we can see that at the beginning the accepted acceptance was really positive, but then after the starting of using the technology it decreased, because they had to learn something new, they had to fight all first barriers of implementation, but after some months when they learned how to use the technology, it is increasing, so they are starting to see positive effects of the technology, and they are adopting it into their actual work processes, and I think that's the most important.
We've spoken about the patient's perspective quite a bit, and what was the personal perspective? Does it feel for the medical staff that the new technologies has reduced the workload or improved the workflow in general?
I would say that they are quite worried, because all of them are overworked person. They already had a lot of activities, and but that's their opinion at the very beginning. After they started to use this technology, and after they get more informed about this technology, then they are becoming more and more positive, and then they accept it really fully. The technology, and they find the technology very efficient. And they respond that the technology can shorten the time that they spend.
I know that you want to react, but I have one additional question. Sometimes people feel scared or afraid of the new technologies because they have an impression that technology could replace us. We know it from 100 years ago, when people were protesting about cars, protesting about electricity, etc., etc.
That's true.
So do you see similarities?
The technology, in my opinion, the technology in medical field will never fully replace the human being. The technology is here to assist, to help,
not to replace,
to predict, to somehow help us to understand better what our patient needs, And that concept, I really like the concept of personalized medicine. That is something that I would say is the part of Eastern medicine, not so Western, but Eastern, because they examine a human being as a whole. They try to understand it. Unfortunately, doctors and staff, they do not have enough time to dedicate to each particular patient. So the technology is here to help in all other activities and to let doctor to do the work that is actually for them. You know?
Yeah, I absolutely agree with Gordana, and especially in the target group of people with cognitive decline, Alzheimer's disease, and other types of dementia. The personal contact with real people is necessary, and technology is something that could improve the quality of care, improve the process of providing care. It could help with this process. It could maybe do the process faster, but the people are absolutely necessary in the contact with people with Alzheimer's disease. So it isn't about replacement of people, but help people.
We went through the patient's perspective, we went through the medical perspective, but also the crucial perspective is the managerial perspective towards the new trends and towards the new technologies. So, Kristina, can we say if the new technologies, also this pilot, is or would be cost effective for the management, because management need to find financial resources in order to finance all of it?
Truly, this question isn't part of our activities because we are doing a feasibility study, and cost effectiveness questions are part of clinical trials to show effect in comparison to cost of the technology. But I expect these technologies could be cost effective because that's something which could help with the care providing. And for example, in the Czech Republic, we see that that's possible a partial replacement of qualification of the staff. So it means that some activity who originally is necessary to be done from a specialist with a university education with the technology is able to do a staff with a course, because the core of the rehabilitation is inside of the technology and not based on the knowledge of the staff. Staff is only a person who will help with using a technology, turn on it, show to the client how to use it. But through this, how to name it, through this replacement of education, that's possible to show a big cost effect, because sure, that's too much easier to have staff with a course than staff with university education. So that's possible to keep staff with university education as a manager, as a controller of the whole process, but the specific activities are done by caregivers with a course.
Plus, the trend is that the technologies are usually more expensive at the beginning, and once they are widely spread, the price of the technologies are really falling down, and they are accessible to almost everybody. We can take a look on the iPhones, etc., etc. Now everybody has it.
What is really important point of social care, the 70-80% of costs are wages of the staff. And if is some technology who can shortage the time of activities, it means that it has potential to be cost effective, because still that's some cost at the beginning in connection to buying a technology, but in long term the wages are too much more than costs of technology.
One of the last topics of the discussion is that expectations and findings from the pilot of the steps that you already been through and the steps that are in front of you.
Yeah, I have to say that this, although I'm from the different field, I'm an engineer, I'm not part of medical staff, but this is one of the really of the best project I ever participated, and I participate in many European projects. So I'm very thrilled to see what will be the outcomes of this project, and I'm sure the project will finish by the mid of the next year, but now we have a lot of valuable results, and we will also have a relevant research data, and we also plan to publish research papers for the whole community to be aware of the outcomes of all these activities and of the particularly introduction of digital technologies in care. So I'm very positive about the outcomes of this project.
Yeah, I think what is a really important point of this project is that we are really implementing the technologies into the practice. That's not only theoretical guidelines,
yes,
but we are really
yes.
implementing the technology into the practice and see how it works, if there are barriers. So that's a big impact into the practical using of technologies.
Kristina Randlova, thank you for coming.
Thank you.
And Gordana Gardašević, thank you for coming.
Thank you very much. I really enjoyed this.